Hi, this is Dr. William. Thanks so much for tuning in to my first episode of Behind the Mask. What I want to do with this IGTV series, Behind the Mask, is kind of to discuss some of the areas of plastic surgery that I find interesting, discuss some of my thought process, my reasoning, the reason why I do things the way I do. One of my goals is always when I deal with patients is to educate them so that we're not just doing things for the sake of doing them, but you understand my reasoning. And we're always focused on trying to get the best results. And I've thought about plastic surgery for years and years, and I go through all of these problems, and I continually learn every single day and change what I do based on things that have happened in the past, and you really grow as a plastic surgery. So in this first episode, I'd like to talk about when to do a tummy tuck compared to liposuction and the relationship of a tummy tuck and liposuction. And my thinking has changed over the last few years, and I want to just explain why that my thinking has changed, how come it's changed, and how it's affected my practice and what I do and my results. Because I think what I do is perhaps a little bit different than probably the standard as to what a lot of surgeons do in terms of the order of liposuction and tummy tuck. So for people that have had babies, that have had twins, that have had a lot of weight loss, they can have extra skin and they need a tummy tuck. The traditional thinking has been to perform liposuction first, deal with the fat, remove all the fat, and then in 6 months later, perform a tummy tuck to treat the skin. And that's the way that I was taught, that's the way I was trained, and that's what I did practice for many, many years. I think now my philosophy and what I do has changed. And I think the reason is because of what's happened with liposuction. So in the old days where I was trained to do liposuction, we really didn't take a lot of fat. We would be very conservative in the amount of fat we took because we were concerned that when we did liposuction, we would damage the blood supply to the skin and then the skin would die. And so what happened was we got improvements in shape, but we really didn't get the types of shape that we're getting today with the amount of fat that we're removing and with the completeness and thoroughness of the liposuction. So liposuction has changed over the years as we now know it's safe, and as we've now really started to focus on shape and get these really dramatic results with very skinny waists and really pretty OG lines. Now we have a different situation than we used to have before. So what I found now is for patients that have had liposuction, it is harder to perform a tummy tuck in those patients now than it was, say, 5 years ago. So in the old days, we used to be able to perform liposuction. It was a little bit less aggressive, a little bit less thorough. There was not as much fat taken, more fat left behind in the abdominal wall, and there wasn't as much scarring. And so we could go back and then remove the skin during the tummy tuck. However, what's happened now with the more thorough, complete liposuction, we know that we can do more fat removal and do more liposuction. There's been more scarring, and the skin gets tougher and harder to remove after liposuction. So what I started to notice a few years ago were patients that were coming in to see me that had liposuction either with me or with someone else, and they had extra skin, which we knew about at the beginning when we did their lipo, and we would say, okay, well, let's 6 months later, we're gonna do a tummy tuck, remove the skin. The problem is they were coming in and I couldn't get their skin to move enough. And some of these patients, I went to the operating room and was really in a situation where I would lift up the skin to do the tummy tuck like I usually did, but I couldn't get the skin to move. And it's a really difficult situation because now you're faced with having to make a fairly long vertical scar because you just can't remove the amount of skin that you normally you normally do. And so it really started to change the way I do things. And it's really totally flipped how I do things. So in the past, where we did more gentle liposuction, I think it was fine. Do liposuction, then do a tummy tuck 6 months later. That worked out well. But nowadays, we have a very strong focus on shape. We're doing much more getting much more dramatic results, removing more fat, and we're getting more scarring and more stiffness of that skin. And it's becoming increasingly difficult to perform tummy tucks after liposuction. So I really got to thinking about this, and I started seeing patients who I'd done tummy tucks on before and started performing liposuction in them, and realized, like, wow, these patients look great. So maybe I'm doing this backwards. Maybe doing liposuction first and then doing the tummy tuck is not really the right way to do things. And so I changed. I started to do the tummy tuck first, where I could get a really good clean tummy tuck because the skin was nice and stretchy. I could remove all of the skin, get a nice tummy tuck, and then 6 months later go back and remove the fat. And I was like, wow, this is fantastic. My results completely went up. And so it's changed the way I practice. So for me, in my practice, what I like to do is I like to do the tummy tuck first. Get rid of the skin, get the skin out of the way. It's not a problem anymore. And then 6 months later, once everything is healed, the blood supply has had a chance to recover, now I can go back in and do the typical liposuction that I do, and I get really dramatic results, much better than when I used to do lipo first and the tummy tuck second. Another point is there's a lot of patients, and I get DMs, many of them every day, where patients have had a BBL or they've had liposuction in the past, and then they send me a photo and they're like, well, I want to get a tummy tuck now. Well, what's happened is, because our liposuction is so good now, it causes the skin to contract and to shrink. And so while somebody may have needed a tummy tuck before they had lipo because they had excess skin, now their skin has shrunk so much that they have kind of a prune belly, or a belly that looks like a raisin with a lot of stretch marks that are kind of all contracted, but the skin is tight, it won't move. So I physically cannot do a tummy tuck on those patients. And it's a very difficult problem now because patients don't have the quality of skin that they want on their abdomen. Their skin is kind of shrunken down. So now we're kind of in this zone where we don't have any option. I don't have any solution to help these patients, and it's really difficult to be in. So I don't want to get into that situation. So if I see somebody who needs a tummy tuck, when I see them originally and they want to have liposuction or they want to have a BBL, then what I recommend is do the tummy tuck first. We'll get rid of the skin, get that out of the way. It's not part of the equation anymore. Everything's nice and relaxed. It's nice and soft. I can stretch it down and get a really good result. Then come back 6 months later. Then I do my traditional OG lipo, get rid of the fat, or I'll do the lipo and a BBL, either one, it's fine. And then we get a really, really good result. So for me, I do things differently. I do my tummy tucks first, and then I'll do my lipo or my BBL. Now, if you want to have your lipo and your BBL and your tummy tuck done at one time, we can do that. We can do it all at once. But what I don't recommend is to do the lipo or the BBL first and then later do the tummy tuck. So, this is just a really good example of how things change with time when you practice, and you just get more experience and you start seeing things and you start seeing different results. So thank you very much for watching it. I appreciate it. Stay tuned for other episodes of Behind the Mask, and we're going to talk about things like who's a candidate for an implant, who should not get an implant. This is something that is really near and dear to my heart. I love to talk about it because not every single person is a candidate for a breast implant. Bye-bye. Thank you for watching.